the good old days. Let me take you back to the good old days. Let me take you back to the good old days.
Oh, yeah.
Let me take you back to the good old days. Let me take you back to the good old days. Let me take you back to the good old days. Let me take you back
Old school, let's go right back in the day. Let's take
Let me take you back.
let's go right back in the day. Sing.
Talofa lava ma lole soifua maua ma lelangi e mama. Nisan bolivinaka ke munisaka na wekanda mai viti. Hello everyone and welcome to Talanoa With Tupe. This is a show where we celebrate and highlight Pasifika success in all its many forms. Each week we sit down with a different Pacific thought leader to hear about their journey and learn from their experience. Today in the studio I'm joined by New Zealand's first female vascular surgeon, the only Pacific Island female vascular surgeon in Australasia, and one of my closest friends, Dr. Lupe Taumoepeau. Malorele, Lupe, thank you for joining us on the show.
Thank you for having me. It really is a pleasure to be here.
Oh, thank you. I know how busy you are, so it really means a lot that you've taken the time to do this. I myself have been inspired and challenged by you since the age of 10, and I'm just really happy that our viewers get to hear about your story.
Thank you. And it just makes me incredibly proud to be your friend, actually, because I have also drawn lots of inspiration from you. So thanks for having me here.
Your parents must be so incredibly proud because both you and your sister Nancy have achieved amazing things. So can you tell us a bit about what was it in your environment that encouraged this attitude towards success?
There were lots of things that contributed to that. I think faith was a big one in my family. I think when times are tough, I turn to the Lord to give me strength, and that's something that both my parents, especially my mum, instilled in my sister and I from a young age. And I think the other thing is that when I was growing up, my parents were separated for a long time, and so my sister and I were essentially brought up by my mum.
Your mum, your mum is an incredibly inspiring person.
I tell everybody that the first really strong sort of female role model I had was my mother, and she is someone who I consider to be extremely compassionate, fiercely independent, and I drew a lot of strength from her. So she sacrificed a lot to give my sister and I the best possible opportunities, and I think I saw her hard work, the fact that she worked multiple jobs, declined offers of help from family overseas in terms of, she could have taken us and moved away to be closer to her siblings and to her mother in Australia. But, she chose to kind of stick it out and really try and give us the best possible life in New Zealand. And so I think those were probably the main factors. She instilled in us a real appreciation for the value of education. So that was something else. If you ask my mum what the secret was, she'd say prayer and the fact that she didn't let us watch TV during the week. So it was a combination of things that really helped us along the way.
There's something that my kids have heard so many times. It's about Auntie Lupe who never watched TV growing up, and you had violin and piano and a whole lot of other lessons that you were doing to keep you busy instead of watching TV.
Yeah, I think, it's a bit hard these days because, devices are everywhere and knowledge is something that, we want instantly. And so, it's a bit of a balance in my household with my son and devices. But, certainly I think having time to, grow our interests in other areas has really helped kind of, shape where my sister and I are today.
Yeah. So you mentioned that your mum raised you away from her brothers and sisters because she comes from quite a large family as well.
Yes,
right?
she does.
Yeah. And quite early on, you had the experience of being in a predominantly Balangi world because you were raised in Remuera, you went to St. Michael's and then on to Barradine where you became our head girl. So what was that experience like for you?
It was challenging sometimes, I think, because a lot of my family in New Zealand or in Auckland growing up lived in South Auckland. So it was a very sort of contrasting time in my life where I was exposed, I essentially lived in one world growing up with school and saw a lot of, I guess on reflection, privilege around me. And I always felt really blessed to be part of that and to have that experience. But then, my weekends with my cousins and my extended family was very different. It was, I had the happiest childhood growing up. My sister and I didn't have a lot of material things compared to our friends who, the kids in the neighbourhood or the kids that we went to school with. And that was something, like I remember going to have a play date with a friend from school and just being amazed at her house, which was 2 stories, and going home to mum and saying, wow, mum, they're so rich, they've got a 2-story house. And mum would always say, they're not rich if they don't have God in their lives and things like that. And, seeing, spending time with my family who had kind of similar, very simple lives was, at times challenging because, when you're a child, sometimes you are immune to those kind of bigger things, but at the same time, I could definitely see that there were two different experiences that I was going through. But in some ways, it also was a real driver for me in terms of realising that I had these opportunities that were available to me that, others didn't have. And so it really kind of made me want to make the most of those opportunities and not waste the sacrifice that I know my mum especially and my parents had made along the way.
Yeah. So, as long as I've known you, you've wanted to be a doctor, and medicine is also in your blood because of your grandfather, Lupe Taumoepeau. How do you take that childhood aspiration and turn that into reality?
I think, again, for me, part of it must be because it was sort of in my blood, right? It was a sort of essentially like a calling. And I guess when I went through school, I was sort of naturally drawn to science and mathematics, sort of the whole kind of problem-solving aspect, which is now a reality in my day-to-day job. Really sort of, that's the part of my kind of schooling that I enjoyed. And so I think medicine was a natural extension of that, as well as a way for me to answer this sort of call to serve, which I think is also something that was instilled in my sister and I, and a lot of young Pasifika people these days. That's just part of our culture, wanting to serve, wanting to help, and to be sort of part of that bigger picture. So I think for me it was partly wanting to be challenged in something that I in a career, but also having the opportunity to, as I say, serve. Those were really the drivers, as well as just seeing my everyday life and knowing that it could be really different one day if I worked hard. So I think those were the main things that helped.
Yeah. So people know a lot about your achievements in the medical field, but maybe people don't know that you're also a very talented musician, that you're also talented at languages, and there are a number of things that you could have done. How did you decide that it was, sciences that you wanted to focus on?
I think, it was really the sort of problem-solving side of my brain that needed that fulfillment. That that was the how I sort of my real sense of achievement came from having a problem presented to me and using a set of skills to try and work through that. I also really love being challenged and learning new things all the time, and that's something that is probably true to lots of different professions, but in medicine especially, there are new drugs, new treatments, new strategies, new operations. The science is not something that we understand 100% when it comes to disease process. So I think that was something that I recognised early on, that medicine would be a way to fulfill those things, as well as this really deep sense of responsibility I felt to sort of take care of other people and serve and give back to the community.
So how did you find the experience of med school, and why do you think it's important to have admission schemes like the Māori and Pasifika admission scheme?
This is a really topical subject at the moment. I'm not sure if you've seen, recently there have been a number of submissions to perhaps change or cap the number of Māori and Pacific Island students coming through the Faculty of Medical and Health Science at the University of Otago. And I would be the first person to say that I think that's absolutely wrong. So my experience, growing up and in Remuera, where I was very much a minority, thankfully I didn't actually come across a lot of, bias, conscious bias. Looking back, there's probably lots of unconscious bias there, but I hadn't really been exposed to a lot of that kind of thing, even at high school. And university was the first time I sort of was confronted with that, right? So, everybody knows that the admission requirements for Māori and Pacific students is less than the general admission scheme, but when I say less, it's not like it's not like a C compared to an A minus. It's, and actually it's irrelevant because once you get into medical school, everybody has to sit the same exams. I've heard people be asked about, when you go in through what they call the MAPAS scheme, whether or not you get the answers ahead of time before you go to sit an exam, which is total rubbish. Yeah. So my experience was of initially colleagues and peers in the general admission population who really sort of looked down on us and felt that we were kind of, second class, and perhaps had friends who had missed out on places at medical school who they thought were deserving. But, I think as far as Māori and Pacific Island patients in Aotearoa, we are by far, leading the way as far as health inequity goes. And there's tons of research that tells us that, Māori and Pacific Island patients do really well when they feel empowered, when they are treated by Māori and Pacific Island, by a health workforce that reflects them.
Yeah.
So I see schemes like the MAPAS scheme as the key way of changing that balance. So Pasifika people make up about 8% of New Zealand's population. If we were to match the number of doctors with our population, we'd have to increase a number from 295 as of the last Medical Council workforce survey to about 1,100. So, 295 kind of sounds like a lot, but our people have been migrating to this country since, as early as the 1950s. So that I don't think that's many.
Well, what percentage of that is of doctors is that?
That's about 3%. So, it's a really small proportion.
It totally comes back to what kind of doctors do we want to have in the workforce.
We as Pasifika doctors have an understanding of what Pasifika patients, what helps them feel empowered to ask questions, to be more informed about their decision making when it comes to their health, realising some of the consequences of their health choices. And there are, other people might not think it's a lot, but there's subtle things in the messaging, in the way you present yourself to a patient, in the way you address somebody, in your body language that I think our people respond to. So I think it would be a real shame if that changed, because I think we can make a real difference. But in saying that, I think the rest of the health system also needs to take responsibility. And so the Medical Council, it's been really nice to see they've come out strongly in terms of things like cultural safety and really challenging all health professionals, not just Māori and Pacific Island doctors, to really examine themselves, their understanding of their own culture, how that applies, being aware of bias when it comes to treating patients. So yeah, I'm absolutely 100% supportive of admission schemes like MAPAS for health professionals.
I think there's a lot more that we could talk about on this, but we have to go to break. So let's do that and then we'll come back and continue our conversation.
Great.
Welcome back to Talanoa With Tupe. We're here with Dr. Lupe Taumoepeau. What's the most rewarding part of being a doctor?
There are lots of really rewarding parts. So the things that kind of fill my bucket and give me joy are seeing good outcomes for patients, and that, that's different things for me. So, the thing about surgery is it's a very hands-on specialty. People joke that, surgeons have a short attention span because we do an operation and we can, it's instant in terms of the outcomes. For me, when I'm dealing with blocked blood vessels, I do an operation to restore the blood flow, and I can tell immediately, that the foot looks better. So there's this sort of real instant gratification that you get from surgery. So, every time I have a good outcome, I find that, rewarding. When patients, when I perform an intervention and spend some time educating a patient about how they can reduce their risk going forward, and I can see that they're taking that message on board, and they come back to clinic and they've made small, meaningful lifestyle changes, I think that really gives me satisfaction. But also I get a lot of joy from teaching, and I come across a lot of medical students and junior doctors. I'm involved in teaching and mentoring for them, and so for me, I also find that part of it really rewarding. Seeing a junior doctor on their first day who's really hesitant, not sure about what they want to do, how their year is going to progress, and then, sort of by the end of the year, just seeing how confident they've become in terms of their skills and, and them getting the same sort of fulfillment out of their job. So, I love all of those aspects of being a doctor.
What's the challenging part?
So in the same way that I love my patients and they give me a lot of energy, they can also be challenging. Some of it's forcing myself to, grow in terms of, when I have challenging situations, I really have to examine what it was that made me uncomfortable about that. Sometimes it's my communication, and so that's a way for me to grow and to learn. Sometimes it's, because I don't have all of the information, so just making sure that I'm really well prepared when I'm having, difficult conversations with patients about, their healthcare, and, some of them are potentially, life-threatening decisions that patients have to make. I also find the system a little bit frustrating and challenging to work in. And, I think seeing the inequity of patients is something that, I find really confronting and challenging in what I do. And there are, seemingly small things that I think can change in the system, but, trying to affect some of that meaningful change on a bigger level, we often come up against lots of barriers. Just I guess trying to work within those constraints and still feel like I'm making a meaningful difference, that would probably be one of the biggest challenges.
Yeah, the New Zealand Medical Journal talked about how 50% of all deaths of Māori and Pasifika are potentially avoidable compared to 23% for non-Māori and non-Pacific. So I guess there's a lot to be done in terms of systemic change.
Lots, yeah. And on a, policy level, on a, hospital management level, but and also in terms of individuals, again, I'm not immune to bias. We all have our own bias, and it's about, I guess it's just a reminder to us all that, we can be part of that solution as well.
Yep. We all have a responsibility to train ourselves to use our slow thinking instead of taking those mental shortcuts which lead us to make wrong assumptions about people or situations.
100%, yes.
Yeah. In terms of your specialty that you chose, vascular surgery, I've heard you explain that as being like a plumber for the body. So can you tell us a bit about the surgeries that you perform?
Yeah. So the vascular system of the body is, I think, really fascinating. So basically the heart is the pump, and that pumps blood around the body through blood vessels called arteries. And then once the blood gets to where it needs to get to, it's got to get back to the heart, so it gets back to the heart through veins. So basically I operate on arteries and veins and the various problems that people develop with those. So a lot of the work that I do involves working with blocked arteries or narrowed arteries, and that can be blockages to the blood supply to the brain, so that can cause patients to have strokes. So I do operations to clear out the carotid artery in the neck that takes blood to the brain. I deal with blocked arteries in the legs for patients who have problems with their walking, or pain, or if they develop ulcers or wounds, gangrene, that kind of thing. We do procedures to try and restore the blood flow. And sometimes people will develop potentially life-threatening problems with the arteries, where the arteries swell like a balloon. That's something called an aneurysm. And so I do procedures to basically repair those arteries when they get to a size where they're at risk of bursting or rupturing. And then veins, sometimes they don't work, and so we do procedures to close down veins when they don't work properly. So it's a very, as I say, it's a kind of practical specialty, and there's a range of different ways that we treat patients using kind of minimally invasive procedures to sort of more open style surgery. So it's a real different range of skills that I have to use, which I enjoy. Yeah.
So when you became a vascular surgeon, you not only smashed a glass ceiling for Pacific people, but for women. And as your friend, I'm incredibly proud of that. Why do you think vascular surgery in particular has been dominated by men for so long?
That's a really good question. I think surgery has been dominated by men for a long, long time, If you look at surgeons in Australasia, women make up 13%, and that's that's slowly been growing. But if you look at the population, that's nothing. And I think there have been lots of barriers that the system that has trained surgeons has actually put in the way, various obstacles. And I think, women have generally had to work a lot harder to get to the top, or, to train as surgeons. And for a lot of women, it's been too hard or not worth the sacrifice of family time and the rest of it. I think for vascular surgery, there's a perception that, what I do is really challenging because the patients are often patients with lots of chronic medical conditions who are high risk, and that has its own kind of, challenges in terms of decision making and that sort of thing, which doesn't appeal to a lot of people, I think. And there's a perception also that not only do we deal with really high-risk patients, the outcomes aren't that good from the type of surgery we do, and also the lifestyle is also, not conducive to having a family in the same way that some other surgical specialties might be, because we get called in for lots of emergencies, trauma, that kind of thing. So that's probably been some of the reasons, but our College of Surgeons, the Royal Australasian College of Surgeons, have thankfully making a lot of headway in terms of changing that. There are lots of strategies that the college have put in place to try and remove some of these barriers. Flexible training, there's been a real change in the culture of surgery as far as breaking down discrimination, breaking down, sexual harassment in the workplace, which has been, a significant barrier to women in surgery. There's a real push towards what the college has termed operating with respect, and that's across the board. So, these are strategies which thankfully the system is trying to put into place, or has put into place, to try and really embrace the idea of being inclusive of women, of minorities in surgery. It's actually a really great time to be in this field. Yeah, so we're making strides, but there's still quite a lot of work to be done.
Mm. And also representation matters. So, having someone like you at the top of the field also, makes a really big difference. I mean, you're the first, but you won't be the last.
Yeah, and I think, that I was listening to a podcast recently where someone was referring to the fact that first is really just another way of saying only, and I think all of these things, in terms of embracing, minorities and other genders in the workplace to try and, reflect the population that we serve are positive moves. So, yeah.
Cool. Well, you touched on a number of things that I really want to explore further after the break. So diversity and inclusion, and also family. Let's take a break first. Welcome back to Talanoa With Tupe. We're here in the studio with Dr. Lupe Taumoepeau. So Lupe, you're a very proud Tongan woman. What is it that you bring from your cultural background that makes you a better doctor?
I think something that's common to all Pasifika cultures is the idea of serving and also respect. And, I think I tell my junior doctors and medical students all the time that every decision you make has to be patient-centred, patient-focused. And, part of that is understanding the patient's story, why it is that they were late to this particular clinic appointment, why they haven't filled the prescription that you gave them, you know, the last time you saw them, all of that kind of stuff. And I think that's something that is kind of inherent in Pasifika people, is this idea of, you know, wanting to really know somebody, really get to the root of their story, spending time to develop that relationship. And, you know, part of that is, just respecting that person in their own right. You know, so I insist on people kind of calling me by my name. I don't really like having the title, although I know that there is, you know, for some patients that's important, that they need to recognise who I am in terms of my seniority and that sort of thing. But I think I sort of have this sort of flat hierarchy in my team, which is something that I sort of transfer when I have interactions with patients, and that's sort of you know, something that I think is part of my cultural background in terms of you know, having respect for elders, but also, you know, wanting to serve them in the way that I do, because you know, I sort of want to get to know them, know what their story is, and then and help them sort of understand why their health is the way it is, you know, what the problem is, what the solutions are, and, you know, how they can also, you know, take some responsibility for that. I think Pasifika people are good storytellers. We're generally good communicators, and I think those things also help me really try and develop a good relationship with my patients.
Yeah. You know, it's so interesting, because I feel like having good relationship building skills is something that gets written off really easily as a soft skill that anyone can do, when I feel like it is such a strength for Pasifika people, because, as you say, it's innate in, you know, who we are and what we do. Nothing gets done without understanding who this person is and who they are in terms of the wider context, their family background, and, you know, all of that kind of stuff, I suppose, really would help a doctor to see this person as a person.
100%. You know, I tell my junior staff that if I think about the colleagues who I have the most respect for, it's not actually the slickest surgeons or the person who knows all the answers, or, you know, knows every single drug reaction, you know, that a particular medication has. It's actually the people who have empathy. You know, it's my colleagues who give their patients time, who give me time, you know, people who are good communicators. I'm involved in selection for candidates for both vascular surgery and also for orthopaedic surgery in New Zealand. And, you know, the things that we look for are, you know, defined by the college as 9 different competencies. The technical side, right, the knowledge side is one of those competencies. The rest of it is all about communication, about leadership. You know, so it's really, you know, and those are the things that I think really shine through in Pasifika, you know, medical students and junior doctors. So it's something that I'm really keen to help them recognise that as a strength, and, as you say, building relationships is really what this job is all about. So it's such an important part. Sure, you have to have the knowledge, but if you don't have a relationship with someone, then they're not going to trust you, and, you know, you're not going to be able to treat them or get the best outcome from the relationship.
So just talking about the range of different skills that you need to be a doctor. So as well as being a specialist vascular surgeon at the Wellington Hospital, you also have your own private practice, which you co-founded. So how was that experience of starting a business?
Very steep learning curve. So has really kind of pushed me to grow in an area that was really, you know, I guess, and to some degree is still a little bit outside of my comfort zone. You know, I think I've learnt a lot in terms of, what it means to actually start a business. I have real admiration for people who do this, and especially at this time for small businesses that have been really hit hard during the as a consequence of the global pandemic. So it's been a real interesting time, and still lots of lessons to learn, but something that I've enjoyed being part of. Yeah.
In addition to being a medical rock star, having your own private practice, you and your husband Alan are raising a wonderful son, Lachlan. What is it like managing a very demanding career with your family life?
So it's really hard. I'm not going to lie about that. And every working mother will have the same story or themes of that same story. For me, I have my career and sort of achieving that part of my life was always the big dream, and it wasn't until very late in life that I decided actually I wanted to become a mother as well. For a long time I just thought I'd be happy being the cool auntie. And so, being a mother has, again, helped me grow in a way that I think also helps me be a better doctor. But, if I'm really honest, I think I don't have time to do both things incredibly well. So I actually rely a lot on my husband, Alan, who is amazing. He's an amazing father, amazing husband, he really has sort of taken a back seat as far as his career, and without him there's no way that I'd be able to do what I do. So I feel really blessed and lucky to have Al in my life, we really are enjoying having our son, who started school this year, and we also have 2 dogs now, so it's a pretty busy time, but I wouldn't have it any other way. It's awesome.
And I noticed that for a lot of successful career women, you really do need the full support of your partner. And do you feel like the contribution of stay-at-home parents is valued by society?
Definitely not. I think it's one of the most undervalued, commodities that we have. It's funny because people are always really quick to praise me. They say, how do you do it? How do you have this, career and be a mum? And actually, nobody ever thinks about Al. Nobody ever says, wow, you are so lucky to have Al, because, you wouldn't be here if he wasn't at home, actually doing the business of running a household and raising a child and parenting and all of that kind of stuff. So, I think that stay-at-home parents are incredibly undervalued, I can't praise them enough. My mum was essentially a stay-at-home mum, right? So if without her sacrifice, then there's no way that my sister and I would be where we are. So big props to stay-at-home parents. I think they do as an important role as those of us who have careers or are in the workforce.
You are incredibly lucky to have Al, and you're both lucky to have each other. But I know from my own experience as well, it's because you've got the dad who's staying at home that frees you up to focus on the important work that you have to do. Yeah, and I always tell people, well, no, we both work, actually, only one of us gets paid.
Yes, that's right. It's exactly the same at my home.
Awesome. So I guess one of the things I just wanted to touch on is that yeah, I mean, as you've mentioned, your achievements have rightly been recognised, both by Pacific media, but also mainstream media. But the thing that, strikes me about that is that I know that you are not someone who seeks the limelight. So I guess what is it that motivates you to put yourself out there and say yes when, you have requests to be interviewed? What is the message that you want to give people?
I think my message would be that as Pasifika people, we can achieve whatever. The sky is truly the limit. When I went through, I had very few Pasifika role models. Most of the role models that I had in surgery were actually Balangi men who believed enough in me to, really inspire me to get to where I am. And, I think without Pasifika role models, the next generation aren't going to, when they need visibility to help them achieve these goals and to see where, what's possible and what opportunities there are out there. So that for me is a real driver in terms of trying to tell my story. If I motivate one person, right, to do this, that's 296 doctors and so the message is, it sounds so cliche, right? Follow your dream, you can do it. But I am a prime example of somebody who, perhaps, I didn't have all the makings of someone who's necessarily going to be successful, but with a bit of work, lots of prayer, I got there. And I just want people to know that it is 100% possible to do what you want to do and lead a really meaningful life and enjoy what you do.
Awesome. Everything is possible through prayer.
Absolutely. Yep. That's exactly what my mum would say.
I love it. So now I have some quickfire questions, which we're going to end our interview on. So, number one, what is your go-to karaoke song?
I do not do karaoke. No, do not do karaoke. Sorry.
Okay. Who was the most influential Pasifika person you knew growing up?
My mum. 100% my mum. Yep. Very strong role model for me.
If you weren't in your current profession, what would you be doing now?
Oh, I think I would have had a go at trying to be a concert pianist.
Okay. If you could invite any 3 people in history to a family dinner, who would it be?
I think I would have Nelson Mandela, Michelle Obama, and, that's a tough one. Maybe the singer Lauryn Hill.
Wow, that would be interesting. Okay, and last question, how do you want to be remembered?
I think I'd like to be remembered as, first and foremost, a good mother and wife, but also as a doctor who really did care about her patients and always was striving for the best.
Awesome, striving for the best. I think that definitely comes through. And I'm just so happy and incredibly proud of you, and just so feel so privileged to have you on the show and to be able to share your inspiring story with our viewers.
Thank you so much for having me. I'd like to say I'll come again, but you know me, no thanks. I feel really happy to be part of this, and also super proud that to see how far we've both come.
Thanks everyone for joining us today. Whawhetai te le lava mo le tātou polokulame le nei aso, soifua ma ia manuia. See you next time on Talanoa With Tupe.